Our PPHA webinar series this month. And just to quickly introduce myself, my name is Sophia Poeta. I'm the program coordinator for the Pennsylvania Public Health Association. So this month is kind of a unique webinar just because we're tying this in with some funding that we got from the Robert Wood Johnson Foundation. I'll go into more detail about that later, but we're really excited to present to you all an advocacy one-on-one session with the Director of Government Relations from PHMC, Malcolm Yates. So to kind of kick things off, I'm going to give you all some background on this project that PPHA is currently working on. So PPHA received funding from the Robert Johnson Wood Foundation through the APHA Affiliate Public Health Authority project starting this past June. As a grantee, we became involved in addressing public health authority through a variety of different areas. So we started out by creating awareness surrounding challenges to public health authority. Then we focused on disseminating information surrounding public health authority and potential attacks on authority through the state of Pennsylvania. Then we worked on collaborating with state partners to work and develop specific action steps that are unique to each organization. And then we developed the Public Health Authority Coalition and act as the lead contact to help advance this work. And through this Public Health Authority coalition, we've worked to advocate for these issues and public health across Pennsylvania. So this is a quick snapshot of who's involved in this coalition and where we all come from. So we have Christine Ganella, who is leading PPHA and is the Strategy Development Manager of the Pennsylvania Public Health Management Corporation. Myself, Sophia Poeta, from representing both PPHA and PHMC, Malcolm Yates, representing PHMC, Jacob Sidechick, the Community Advocacy Director from the American Heart Association, Logan Weldy is a staff attorney from the Clean Air Council, Alexandra Whipple, she's a public health educator from the Erie Department of Health, Raya Griffiths is a grassroots and communications project manager, public health affairs and advocacy from APHA, and then Angie McGowan is also a representative from APHA. So through this work, we've noticed that Pennsylvania, their public health authority is uniquely impacted by an issue called preemption. So preemption is a legislative tool whereby the federal government or a state government withdraws the authority of a lower level of government to act on a particular issue. So this basically limits the ability of a local public health authority to conduct their normal business, including pandemic responses. Given the uniqueness of the COVID-19 pandemic, this is when we really started to see this come out with mask mandates, school closures, and then it's kind of expanded more widely to even impact gun laws and reproductive rights. So our Public Health Authority Coalition has taken many steps to kind of develop our work in this area and also increase knowledge and disseminate information. But first, we had to increase our own knowledge and background information. So representatives from PHMC and PPHA attended the APHA Policy Action Institute that was in July in Washington, D.C., that revolved around advancing policy to improve health priorities for PA specifically. So here we learned about preemption and how we could make it more widely known and understood, and how we could increase our coordination through dissemination of information and a collective response. So through this, we really focused in on how are we going to organize our understanding, and then how are we going to strengthen and combine a collective response across stakeholders from Pennsylvania. From this, we held an in-person convening with stakeholders across the state after the midterm elections to discuss proactive ways to protect public health authority. We identified opportunities to address public health authority preemption in the next 1 to 2 years, forming deeper relationships and connections to support ongoing and new efforts to advance public health in Pennsylvania. And we discussed opportunities, challenges, strengths and weaknesses across regional, political, and topical areas across the state. So we specifically looked at, in terms of regional, we looked at Eastern, Central, and Western PA, how they're different, how they're the same, how we can coordinate our responses, and how we also have to recognize that the responses may have to be different depending on their regional differences. Then we looked at areas of Pennsylvania that are primarily blue, purple, or red. And then we also looked at three main topical areas, including public safety, environmental health, and reproductive justice. From this conversation, we held a follow-up session in January to disseminate the results from our discussions and to formalize next steps. So where we are now, story generation session at our Mid-Atlantic Conference, March 17th at 8 a.m. So we're looking here to convene more people from across the state of Pennsylvania and to gather some really personal or professional stories on how you were either grateful for public health authority laws and protections, or you felt weakened by a lack of public health authority laws or protections. From this conversation, we hope to bring what we've discussed and the stories that we've heard and hold a legislative briefing in Harrisburg on April 27th with all new members of the House, along with members of the Health Committee. I've attached a rough agenda of what we're trying to organize this briefing around. We're going to start off with preemption training and then go into connection to issues of importance across the Commonwealth, utilizing the stories we generated in March. And then we're going to continue to build off of these three core content areas that we discussed in November. Again, those were public safety, reproductive justice, and environmental justice. So now I'm going to turn it over to our guest for today, Malcolm Yates. This will kind of tie in with all the work that we have coming up as we continue to mobilize and also really focus in on the importance of your work as public health professionals in advocating for public health authority. And Malcolm will give us a really in-depth idea on how we can connect with local decision makers and how we can get them to relate to us and continue to protect public health authority across the state of Pennsylvania. So I'm excited to welcome Malcolm Yates, and I'll turn it over to him now.
Thank you, Sophia. Thank you for that. And good afternoon, everyone. And thank you so much for registering for this, this session, getting active in government. The work that we're trying to do now, we felt like giving a briefing on what and how to engage our elected members was necessary, because some of us, we have a lot of experience dealing with our elected members, but some organizations and some nonprofits may not have that background or have that experience in doing it. So this is why we decided to do this today. My name is Malcolm Yates, and I'm the Director of Government Relations for PHMC. That's enterprise-wide, covering all of our affiliate and programs. That's on a municipal, state, and federal level of government. This presentation comes at a pivotal time because, as you know, we are starting a new legislative session with the new governor administration, and there's so many new faces in the House. Committee assignments hasn't been just assigned yet, and I just got an email that Representative Clinton was voted on being Speaker of the House. So as you see, things are continuously turning. But just to give you a little background on me, I've worked on each level of government from over the last 20 years, starting off at knocking doors for council members in Philadelphia, then chief of staff for a state representative in the 159th district for the PA House. And then I moved on to be district director for Congresswoman Mary Gay Scanlon for 3 years. I'm currently serving as the Southeast Regional Chair for the PA State Committee. That's covering Delaware County, Bucks County, Chester County, and Montgomery County. And this is my third term as a state committee member. So I just have you could say I can have just a little bit of experience in government. So the information you'll get today, again, most of you may know, but it never really hurts to hear it again. What's this next slide? So the purpose of this workshop is one, to be very ground level. First, how to identify, find, and then engage your local officials. Learning steps on who your city council members are, your state rep, and your senators. Finding your federal members, getting their district office information, which is imperative, because depending on the issue that you have, knowing what office to go to and to solicit is part of the actual engagement. And then you're going to learn some pieces of the legislative process. Go next slide. You go to the next slide. All right. So when it comes to political engagement, there's a lot of things, there's a lot of times the work itself is not as tangible as one would think. Political engagement can't be measured deliverables like most work has. There's no KPIs, there's no ticket count, or no, bottom total profit revenue when it comes down to political engagement or advocacy. Political engagement to me is measured by the many interactions you have with you or your group have with the elected member and their staff. That's in the form of supporting community events, donating to fundraisers, tabling job fairs, health fairs, or even a senior bingo night, and appearing at community projects like a ribbon cutting at a new rec center or a school. So one of the major issues that constituents are, no, you can go back, I'm sorry. So when you start looking at the legislative process, you have to look at what some of the issues that that's facing the constituents. Whether this issue is, whether it's something that's very, very basic and minor, or something that's very, very large. And the way that you look at this is one, through through phone calls, current topics that's currently out, and with your lobbyists and stakeholders outreach, right? So I wanted to look at what create legislation, because I feel like a lot of us don't really see how basic and simple the process is. And now that we are at budget season, on March the 7th, we will hear exactly what our governor has as a fiscal priorities for the state during his budget address to the House. But when you start to look at the news and pay attention to the current climate of, like, let's say, public health, you'll start to notice a trend developing. Normally, this trend will transcend into departments' new directive or goals. Well, this new issue or trend is very similar to what we call constituent legislative issues. And these come in calls from our constituents and start new policies, a resolution, and amendments of bills in its entirety. Once a trend is recognized and you feel that it's necessary for our elected members to know about it, it's best to do a due diligence. One, reach out to your counterparts, subcontractor, vendors, to hear if they are experiencing the same issue. Then reach out to the large stakeholders that's in your field. So for us, it would be something like, UAC, VHS, IBX, to compare and hear what their strategy is, right? Once you congregate all this information, then it's time to reach out to your elected members. You need to find out, one, if the issue is a municipal issue, state issue, or a federal issue. This designation will come while you're doing, again, your due diligence. Once you identify the most influential or impactful member, look up their committee assignments. So once you find out who your state rep is or your city council member is, whatever the designated issue, look up their committee assignment. And then call their district office to find out who their staffers are and who's their subject matter expert. Doing that there, one, engaging the district office and the staffers, those are the ones who are going to get your issues and book your meetings. They're going to put your issues on the front of on the priority list, and they're the ones that's going to book your meetings. So getting an understanding and reaching out to those district staffers is very, very imperative to get things done. Because a lot of times when you start to talk to elected members, and in your experience, you can see, you'll come to a member and you talk to them about an issue that you have, and you'll get a yeah, sure, sure. But most of the time they'll say, talk to my staffer X and Z, right? Those are the ones who's going to actually put together the briefings, put together the research, and get you to the table. So make sure you know who that is. And then once they grant you that meeting, remember, you can only advocate as a nonprofit. You can only be an advocate to the issue. So you're suggesting things like, we're advocating for the best of this issue, right? I say that because you have to make a differentiation between making an ask and being an advocate. Let your lobbyists do the ask. That's what you pay them for. But for you as nonprofits, you are the advocate. So make the advocate. It may not seem like a lot, but according to the state lobbying rules, trust me, there's a big difference. Next slide. So knowing your city council, the reason why I picked this, here, and I just put two up on there, just representing Philadelphia and Erie, because a lot of times you need to know who your local county commissioner or city council person is. As you see, Philadelphia has 17 members, 10 district, 7 at large, and Erie has 7 council members, all representing their respective wards. Again, if the issue is municipal, please find your city council member, locate where it's at, and find their district office, and then go to your grievance. And then voice your grievance. Next slide. Now here's a map of the PA legislative map. Here there's 203 total members, but as of yesterday or today, it was 202. And as we just heard again, we just know who the speaker is, and how you locate your state legislator, as you can see here on the map, has it designated and how it's sparsed out. You find your area, find where you cover, and those a little small, but you can actually find who your legislator is by their number on a district. But we'll have on the next slide. You can go to the next slide. And here's the easy way, right? Just go ahead and go to find your legislator at the website there, and we can put that in the chat. As you'll see, that site will come up, put the address of your location there, zip code, and then boom, you'll get your state and local legislator there. Next slide. And over these next slides, it's breaking down who who's your representative is in each county. As you go through, you'll see here, representing in red is your Republicans, representing in blue is your Democrats, and it also has the numbers corresponding to the district that they are in, which is matching the map that we previously saw. Let's go next slide. Next slide. Yep. So when it comes down to the Senate, there's no map needed for our Senate, because as we know, each state has 2 senators. There's no geographic breakdown. Each senator represents the entire state and handles things each way. Here we are now with Robert Casey. As you see, Bob Casey in his district, his Washington office and his committee assignments. And we have here Senator Fetterman. He's newly elected, and I don't think he has any assignments as of yet, if I'm not mistaken. But this is the information where you can find our senators. Next slide. Now here's a breakdown of our congressional map. Last year we had 18 congressional members due to the redistricting that happened. Now we are down to 17. And this is a good way to, again, find your county, find your area. You'll be able to identify what congressional district you live in. As you see, I used to work for Congressional District 5, which is Mary Gay Scanlon there in the Delaware County area. Right? Next slide. And then here's just a breakdown in areas of our Pennsylvania members of Congress, going from Congressional District 1 all the way up to Congressional District 17. Go to the next slide. Next slide. All right. So what did we learn, right? When it comes down to, political engagement, there's one way to look at it, and I look at it as, again, going back to effective engaging our members on a, I want to say, almost daily basis, depending on your issue. Effective political engagement translate for me here at PHMC to becoming one of the first organizations that to come into mind for the elected member when they're looking for appropriate funding, create legislation, and facilitate community programs, or partner with larger stakeholder. I look at political engagement as marketing and branding of an organization to the political field. So my job here at PHMC is to make sure that we are the number one option in our elected members' minds when they come to the House floor, creating legislation, policies, or anything else around the public health field. We also identify who our state and city federal members are. We went through a little bit of the legislative process and how it starts, and we went through some tools of looking for your members using, Find My State Rep and some of the things for the PA House. And also we discussed the difference between lobbying and advocating. Again, we are all advocates, and I want to stress that more. We are all advocates. We are not lobbyists. That's what we pay those retainers for. So when you go into these offices, again, make sure you make the advocate, the plea that you're advocating for, not making the ask for them to do something. Is there any questions? Seeing no questions, I'll turn this back over to you, Sophia.
Great. Yeah. Thank you so much, Malcolm, for that really informative presentation. Hopefully that helped give some clarity and some background on the current work that PPHA is doing, some of our partners, as well as and almost like an invitation to keep doing this work in what you're currently doing. If anyone has any questions, my email, I can put it in the chat. And we did record this session, and we will be posting this on our YouTube page later.